Hello and welcome to yet another episode of Dr. Sin. Today we have with us Dr. Shankar Vinod, who have been specialized in oral and maxillofacial surgery. Let us welcome him to the program. Welcome, doctor.
Hello.
Could you tell us your experience in the field of oral and maxillofacial surgery?
I started my training in maxillofacial surgery at Government Dental College, Trivandrum. I completed the course in 1997. I have since been working in various hospitals and presently heading the department at the Mar Basilis Dental College at Kodamangalam. And over the years, there have been a lot of improvements and in this specialty. And now there is a lot of interest towards dental implantology as well as towards surgical correction of facial deformities. This is an area which I am interested in.
Yeah, okay. So now moving on to the topic, what is actually a dental implant?
When you lose a teeth, there are various options to replace the tooth. One of the previously we used to replace it with fixed partial dentures. In that, we need to actually prepare the adjacent teeth for incorporating these crowns, and that is how we used to replace the tooth. Now what we have, what is called dental implants, which are basically metal screw kind of screws which are implanted into the bone, and the crowns are loaded on top of that. So it can be used for partial as well as even as fully replacement of an entire teeth. It's possible with that. And an extension of these dental implants, you have maxillofacial implants. When there is a loss of a part of the jaw, you can also replace it using these implants.
Okay. What are the advantages of dental implants?
Basically, implants are basically made of titanium or oxides or other metals of titanium, which have the property when you are implanted into the bone actually grows through it. So it becomes part of the body. So that is the main advantage of these dental implants. And the advantages being that when you're replacing tooth with the other previous methods like fixed partial dentures, you have to actually disturb the adjacent tooth, prepare the adjacent tooth before you could give a replacement. But with implants, it is basically like a screw kind of thing that is implanted into the bone, and the crown actually comes on top of that. So when you use it for function, or like chewing, what happens is that the force is transmitted to the bone, and that force actually helps to stimulate the bone, and the bone is maintained in that level also. So the patient is able to better tolerate it, and it gives you a comfortable feel compared with other acrylic removable dentures and all that. That is the main advantage of this fixed denture. But the problem being that the patient has to be medically fit to undergo the procedure. In controlled, medically compromised patients also you can do it. That is patients with diabetes and all that, in whom the situation is controlled, you can actually go with the procedure. But there are some situations in which you cannot do the procedure because of their medical problems. That's the disadvantage of this. And this technique needs special training, and this has been incorporated to incorporate implantology into your practice, you need special training for this.
Okay. What are the main precautions that the patient should take before they undergo a treatment?
The main, what a dentist or a surgeon who is doing implants, what he does mainly is to assess the patient's general health. So, fitness of the patient to undergo is procedure under local anesthesia, or sometimes if there are multiple implants, you may even have to do the procedure under general anesthesia. So, the patient has to be fit to undergo the procedure. That's the basic thing. And the patient to take care that the quality of the bone is maintained. That is that if he has any problem, like when he has periodontal disease or gum diseases, he should make sure that he gets proper treatment early and maintains a very good oral hygiene, which is quite essential for the success and long duration of retaining these implants.
Okay. How is the whole process done for dental implants?
The process starts with assessing the patient actually. What you do is that you take X-rays, and there are some three-dimensional CTs or CBCTs that you take to assess the quality of the bone and the quantity of bone that is available. And based on this, you decide on the size of the implants that are required to replace it depends on number of teeth that has to be replaced. Suppose there are 1 or 2 teeth, it is much easier Comparatively, when you're doing it for the whole full mouth rehabilitation, like in a patient who has no teeth, it becomes a complicated procedure. Initially, you have to assess the patient regarding the what he requires, the number of teeth that is to replace, and it depends on if he needs replacement of few teeth or the entire teeth. So that the procedure in assessment as well as management is different for both these cases. If it is for one or two teeth that it needs to be replaced, what you do is that you need to assess the quality of the bone and the alignment of the area with the opposite dentition. That's if he has teeth on the opposite side, how the alignment is the relationship of the jaw with the opposite side. That has to be assessed, as well as also the amount of bone that is available there for you to place the implant. The next step is to assess the size of the implant, the quality of bone that is available. The most important thing is the quality of the bone. Patients with medical problems like problems with calcium metabolism, all these problems will have to take special care for these patients. Otherwise, the basic steps involved is basically to assess the blood, do a blood routine test of the blood to assess that he does not have any other medical problems. Do a general checkup of the patient, including BP and sugar and all these things. And then what is required is you need to take X-rays to assess the quantity, like I told you, the height of the bone and things like that, and then do a CT also. And based on these measurements, you can actually calculate the amount of the type of implant or the size of the implant that is required. And it is the procedure as such is very simple. Actually, it can be done under local anesthesia. If it is for one or two implants, you can just give local anesthesia, and it is you wait for the local anesthesia to act, and it's a very small, simple procedure. It actually is much easier than actually doing a tooth extraction. So, procedure is actually so simple. Only thing is that it has to be done with care, and you have to take care when you're doing the procedure that the steps are followed properly, and proper sterilization and aseptic technique, the usual that is followed, is adhered to. That's the main thing. And for the patient, can go home after the procedure. Maybe it will take about half an hour. If it is a single implant, it will take maximum, I think it will take half an hour. But there are some situations you might need some grafts or something to be added, then you might take some time longer. Otherwise, it is a half an hour outpatient procedure. Patient can go home after the procedure. But for all procedures involving when you're giving anesthesia, local anesthesia, you would expect the patient to be accompanied by a friend or somebody who can take care of him when he goes home. Then he might need antibiotics for about a week or so. And that's all. Something for pain, mild swelling, the usual complaints that whenever there's a minor surgical procedure being done. It is so simple. But after the procedure has been done, you need to actually wait for about 3 months for this implant to osseointegrate. What the process of the implant integrating with the bone, that is called as a osseointegration. It will take 3 months at least. And older patients, you might have to add 1 or 2 months also. But when you are doing this procedure, it is a two-step procedure. But there are some implants that can be done with a single-step procedure also, especially in the anterior region or even immediately after tooth extraction. It depends on the material that you're using or the type of implant that you're using. You have different choices.
What are the advice given to a patient once the treatment is done?
The usual advice that you give to any patient after a minor oral surgical procedure, that is to have cold diet on that day and not to take any warm diet just for that day of the surgery, and do the normal activities like toothbrushing and use of mouthwashes what he has been advised. He should follow those instructions, as well as the medicines that he has to take. He should take it regularly, and the next day onwards he can have, after 24 hours he can take warm saline gargles for 2-3 times a day and report back depending on for suture removal after a week. Usually you don't expect much of discomfort, very mild swelling in some cases. But the medicines that he has been given will take care of all these things. But if there is any change in the situation, that he has some discomfort which he is not able to tolerate or anything, you have to report back immediately. Usually that is not expected with these patients. 1 week back he should come for suture removal and the follow-up. If it's an immediate implant, you can load it immediately after a week. Or other situations you might have to wait for 2-3 months for loading the implant. Loading means that actually placing the crown on top of the implant.
Okay. Will there be pain for the patient before or after the treatment?
Uh, Not much. That is, the medicines that is being given should take care of it. And it is a small procedure, just as surgical procedures, minor surgical procedure. Some discomfort and might be expected. But pain, I think the analgesics that is given, the painkillers that is being given should take care of it.
Okay. For how long the patient should be hospitalized?
There is no need for actual hospitalization if it's a small, that is, the number of implants are less. But there are even cases where we do more number of implants at a single sitting. And nowadays, it is even possible to decide the number of the implants and the site of placement of implants on the bony ridge preoperatively using software. You can use guided implant placement using computer-aided software, which can be used to make templates. You don't even need an incision for that. In some situations, you can directly place the template and fix the template and place the implant directly. In those situations, you don't actually need hospitalization. If for antibiotics, you might need to take for a week. Okay, that's a usual pattern.
What is the actual cost for this treatment?
It does vary from center to center and the type of implant that you use. Because the implant, there are different companies marketing implants. You have European as well as even companies from Israel and other places. So it does vary. But the general trend is that it costs somewhere between $1,000 to $2,000 per implant. It would depend on your center where you're going. There will be, and sometimes depending on the grafts or other material that is required for the procedure, the charges might vary a bit.
Is it possible for the implants to be removed permanently?
Yeah, it is definitely possible to remove all these implants. But the basic purpose of an implant is that something stays there permanently, to which you can attach the teeth. So as long as it is staying there, there is no need for it to be removed. But usually it comes loose when it gets infected or there is a failure of the implant. That is when it comes loose. Other situations, to remove the implant, you will really have to cut it out. But usually, you need not remove it unless there is an infection or there is some problem in the patient is not able to tolerate it. Usually there is no indication for removal if it is firmly attached.
Okay. Yeah. Can a person have all the teeth implanted?
Yeah, definitely. You can actually have all the teeth implants. Ideally, it would require around about 10 to 12 implants on one arch. That is the ideal situation. That means you would require implants on the upper as well as lower implant.
Won't that be very painful?
No. Actually, you are doing it under anesthesia. No. The implant, the process, it's just making small drill holes. The size of the implant is it comes in different sizes depending on different companies. 3.5 mm, 4.3 mm, like that. So that's a small size. You just make small burr cuts into the bone. Small burrs are used to drill into the bone, and actually this implant is directly placed into these holes that are made and covered with the gums. That's all. It is a very simple procedure, and it does not hurt unless there is some problem with the implant. That is when there is an infection or something. That's when it hurts. Otherwise, like for when you do a small procedure in the mouth, like forget tooth extraction, any small surgical procedure in the mouth under local anesthesia, that is a discomfort that is expected with implant placement.
Doctor, thanks a lot for being a part of our program.
Thank you.
So that was Dr. Shankar Vinod with us. Until we meet next time, this is me, Naina, signing off. Take care.